All right, good morning, everyone. This is the third of our four planned community assessments and plan webinars with our partners at HPIO. Haley and Amy are back with us again this morning to walk through some new material. We also have some presentation material from other staff here at the department as well. So jam-packed agenda. This is extended a wee bit. We're going to schedule it to 11:15, just so we have time to kind of fit everything in. So just a brief agenda set. We will be touching briefly on SMART objectives and the outcome indicator menu that we reviewed at the last webinar. And then the second half of this will then be walking through data demonstrations. So for those of you who are potentially looking for outcome indicators, those you know what your outcome indicators are going to be and then where to find that information. Or if you really don't have an indication of either one of those and you're still working on your plan, we're going to show you some resources where you'll be able to get some data, so secondary data in real time. So we have 4 or 5 sources that we're going to walk through for you this morning. So hopefully this will be of use for you as you then work on your annual updates and report that you have available to you that will be completed starting in 2024. So with that, I will turn it over to Haley Aka from HPIO. Good morning and welcome, and thank you for joining us again.
Good morning, Chad, and morning, everyone. Thank you guys so much. Amy, are you going to put the slides up for us? That would be great. Haley Aka, joining you all again with my colleague, Amy Bush-Stevens. I'm glad to be with you to do a deep dive on our indicator menu again, look a little bit more closely at that. And then like Chad indicated, we're going to look at some specific data sources that will be useful for you in your community plan. As always, we want to be responsive to the questions that you have as we move through today. So please use that chat box. We know that you are getting into the real nitty-gritty of this work and likely have run into some trouble spots or some questions that need clarifying. We would love to answer those specific things for you today. Next slide. We would like to start, or we do start each webinar, with our CAP framework, what we call our pathway to impact. It reminds us of our theory of change, how selecting strategies and SMART objectives for the things in the green help us achieve the vision on the right of ending suffering from mental illness, substance use disorder, and problem gambling across our state. Today, we're discussing in even greater detail the data sources that will help you track progress towards that goal. Chad gave us a good sense of the agenda today. We're going to start with a really brief recap from the material from last time, just to ground us again in SMART objectives. Then we're going to be looking deeper into the indicator menu and doing some of that live demonstration of some common data sources that will be helpful for you as you're pulling data for your SMART objectives and for your annual updates. We'll wrap up with next steps. Okay, I get us started this morning with that brief recap of the outcome and SMART objective material that we discussed last month. So in November, we discussed the difference between outputs and outcomes, and that the CAP template is structured to help us build a stronger focus on outcomes. So here's a refresher on the difference between the two. Outputs are things that we do. They're tangible, countable, products of an activity done by your organization, typically measured in volume. So things like number of trainings given or number of program participants. Outcomes, on the other hand, are the results of those things that we've done. Outcomes are aggregate data that describe the impact of service, program, or changes to systems or policy. So we'll look at an example on the next slide. So this is an example from trauma-informed care. An output in trauma-informed care might be the number of participants who attended a trauma-informed care training. The outcome of that training might be the percentage of those participants who report increased skills in trauma-informed care. Maybe we collect that in a survey after the training. Even further along the pathway, another outcome could be treatment retention rate. We could measure the hopeful increase in this in the retention rate because services are now more trauma-informed. So that's a sense of outputs versus outcomes, and being really clear on your outcomes. Yeah, go ahead to the next slide, Amy. Thank you. Being really clear on your outcomes is the first step in creating SMART objectives. And this slide lays out the process for selecting your plan priorities and deciding which SMART objectives you want to create for your plan. So, like we see here in our inverted triangle, you start with your completed assessment, the work that you've already done, where you've looked at all of the various strengths and challenges of your service area. That's your starting place. In that assessment, moving to that middle section of the triangle, we also noted the top challenges that your communities experience in mental health and addiction outcomes, in access to services, and in the social determinants of health. We want to be prioritizing those top challenges when we're thinking about our SMART objectives in the places that we want to drive progress. That furrow narrows our set of priorities, and then in the plan, we'll just be prioritizing one thing, one strategy and corresponding SMART objective across each continuum of care item, and creating a SMART objective to measure that thing. So let's look at an example of that on the next slide. Let's say we're working on selecting our priority related to prevention. We know we have to create a SMART objective and have a strategy related to prevention. It's on our continuum of care. So we've got our completed assessment template in front of us with all of our challenges identified. So we start looking at where we've noted top challenges that are related to prevention. So on our next slide, we see in question 1B of our assessment template, we have our mental health and addiction challenges, and this is specific to children, youth, and families, because that's what we want to focus on, we've decided. And we see that our top challenges here, we see that in the column on the right, and one of our top challenges that we identified is youth suicide death. And now we know this is the conversation we're having as a team, right? This is a really severe problem. There are significant disparities. We know that other partners are concerned about this. There's momentum towards solving this problem. There are strategies that we can implement. We've already begun doing some of that work. We decide this is really important. This is what we want to select for our prevention priority. Then we head over to our plan. And next to prevention, we know we want to have an indicator, an outcome indicator related to youth suicide. So we head to the indicator menu, we find youth suicide deaths. This indicator that you see on the screen, we plug that in. We know this indicator comes from the Ohio Department of Health Vital Statistics, from the Public Health Data Warehouse. That's also listed in our indicator menu. So we plug that in as well. And now we're, a third of the way to developing our SMART objective. As a reminder, these are the components of a SMART objective. This is a specific format for using data to track progress. Next slide shows us that the first two components are the indicator and the source. Next slide, we saw that in the example that we just walked through, that our indicator is the number of deaths due to suicide for youth ages 8 to 17 per 100,000 population. And that the source of that indicator is ODH Vital Statistics from the Public Health Data Warehouse. Next slide. Another critical component of SMART objectives is that they need a target. Not only do we want to know how we're currently performing on the indicator of interest, what our baseline data is, we also want to set a target for seeing progress in the future. This target should be achievable and realistic. Those are the A and the R of SMART. We want to be able to achieve the goals that we set, but we also want this to be a little bit aspirational. We want to shoot for real improvement here, even when there are barriers to seeing these things improve. So finally, time bound is the last element, and that just means that we want to set a date by which we want to see that improvement happen. So here, back at our example, we see our baseline data year is 2018. This is what we went and pulled from the Public Health Data Warehouse. So when we identified this as our outcome indicator, we said, okay, how are we doing now? What's the most recent data we can get? Most recent data we can get here is 2018. So we put that baseline year and the baseline data value, which is 4 deaths per 100,000. And then we decide we want to set our improvement to 2025. We want to measure at 2025 how much have we improved, and the target here we set is 3. Here's another quick example. So let's imagine we're considering our priority for harm reduction. And we look at our top challenges in the assessment and we decide to focus on overdose death. This is really the ultimate outcome of harm reduction. What we want to see is decreased death from drug overdose. So we select that outcome indicator from our indicator menu. So that's how we get the outcome indicator and the data source. And this data source is also the public health data warehouse, and we're going to get a demonstration of how to pull this exact measure from the public health data warehouse today. And this baseline data was actually provided to us in the county profile that the department provided. So we go and pull that baseline data year, which is a combined 2019-2020 year, and the baseline data value that was given to us in the county profile. And then we decide we want to, by 2024, we want to improve by 20%. That's a decision that we make. And so we do some quick math. We set that target for 43.4 deaths per 100,000 by 2024. And that's our SMART objective. The final example that we'll look at has an equity focus. So a reminder that at our October webinar, we focused on infusing equity into the assessment and planning process. There's a technical assistance fact sheet available on this topic as well. We won't dive a ton into it today. We'll hit it in bits and pieces. But here I want to mention that setting SMART objectives to address disparities is an optional component of the CAP, but a very important activity for improving health and well-being for priority populations and for communities overall. So we want to make sure to give you an example of how that looks. Here, this fictional Montgomery County that we're all being together, we've decided that we want to focus on overdose death again, but we want to look at overdose death specifically for Black residents in our community because we're noticing an increasing disparity and an increased rate for Black residents. I think this is a great idea for selecting an equity-focused SMART objective because it's built on one that you've already set for the overall community and just highlighting, tailoring it to a disparity that you've identified in your assessment. So you name your, go back, please. You name your priority population, Black non-Hispanic residents. You pull over the outcome indicator and data source from that SMART objective you already created. It's the exact same data because we know it can be disaggregated in the public health data warehouse. We can pull that data down. So we do that. We have the same baseline year, but we pull the rate for the overdose death rate for Black residents, which is 65. And then we want to set a target for 2024. Here we decide to set the exact same target for Black residents as the community overall. And we do this because we want to show our commitment to equity. We want to see disparities close. And so by 2024, what we're saying is we want the community overall to have an overdose death rate of at least 43.4, and we want the Black overdose death rate to be the same. We don't want to see any gap. So that's an equity SMART objective. Are there any questions? This is all recap from our last webinar together last month. Any questions about sort of the mechanics of SMART objectives or the purpose of SMART objectives before we dive nitty-gritty into the outcome indicators and actually pulling the data for baseline?
I am not seeing anything in the chat, so I think
Crystal clear.
we will keep going.
Beautiful.
But if you think of anything for the content that Haley covered, you can put that in the chat. Good morning, everyone. I'm Amy Bush-Stevens with HPIO, and I am going to talk about the standardized indicator menu. This is that Excel spreadsheet that has lots of indicators and data sources in it that Chad shared with you. We had an updated version in November. We actually have a newly updated version for December that we added an additional data source, and Chad is going to make sure that's posted on the community plan website and may also be sending it out via email. Quick reminder of what the indicator menu is and is not. So it is meant to be a resource for you to use in your assessment and in your plan. It has indicators that align to other initiatives at the federal and state level, so we didn't just make things up. And it has links to real data that you can pull. In terms of what it is not a requirement that you use any or all of the indicators here. It really is meant to be an optional resource. It doesn't necessarily include everything that you might want to consider for your assessment or plan. You may have additional data sources available to you in your community that you want to use instead, but it is a good starting place to work from. This is just to illustrate, on the left is taken from the CAP plan template, and then on the right is taken from the indicator menu. So you can see the template is asking you for an outcome indicator. The menu lists a whole bunch of outcome indicators, and then same thing with the data source. And on our last webinar, we shared a few examples of indicators, and I'm just going to go through these really quickly because I want to get to an even more realistic example for you. So we've already talked today about unintentional drug overdose deaths, and later on the webinar, Lorena from our team is going to demonstrate how you can actually pull that data yourselves. This is a prevention example, youth marijuana use from the OHS survey, and we're also going to hear from the OHS staff at OhioMHAS later on the webinar today on how to do that. This is data that you can request from OhioMHAS, and Craig is going to talk about that. And then this last example is just one where you would have to collect your own data from your providers. So an example from Crisis. So just a few examples there of indicators that are available in the menu. So now I want to share, there was a suggestion from the last webinar that we provide some real examples from boards that are doing this work. And we actually have been working with MHRB of Clark, Greene, and Madison counties for the past year or so on some work. And right now we're helping them to develop SMART objectives. This is actually a project that sort of predated the CAP and it has an equity focus, but I think there are some useful examples from it and we can think about it generally as well as specific to equity. So we are helping them to develop some SMART objectives, and we're using these steps to get there. And we're actually right now, we are working on step 5. And you could use these steps might be useful to you as you are also developing SMART objectives for your CAP. And we'll of course provide these slides, so you'll have these steps. So step 1 was to review assessment findings. And in this case, MHRB has done some qualitative assessment work over the past year, some focus groups, community discussions. And these are some key themes that have emerged from that work. So as they think about their SMART objectives, they're being mindful of these themes so we can identify some indicators that address these themes. Step 2 was to go to the indicator menu. So the staff at MHRB reviewed the Excel spreadsheet with those assessment findings in mind, that qualitative work as well as other information that they have collected. So they reviewed the Excel and they identified 40 indicators to explore, which is a lot. Our goal is to get to no more than 12. So that was kind of our starting universe, a list of 40 indicators. The next step was to explore availability of the data. So the spreadsheet does indicate if the data are publicly available, if they require a data request, or if in some cases there is no data available and you would need to collect it yourself. So in this step, we were going to the websites, making sure we could pull down data for the 3 counties, and making some data requests. So really getting our arms around what data is actually available and what does it kind of look like for the 3 counties. And as those of you from smaller counties know, it can be a challenge to get data for smaller counties. And so we had to look at how realistic was the data availability for Clark, Greene, and Madison. So as I mentioned, they identified 40 indicators, but we wanted to get to 12. So we knew we needed to narrow the list and that was going to be a challenge. So these are prioritization criteria that we used to help us narrow down that list of indicators. You could use these same criteria as you go through this process, or you could choose some of these or develop your own criteria. This doesn't need to be set in stone, but we found this to be helpful. So the first is being that the data is available at the local level. And in this case, because they do have a focus on equity, they are looking for indicators that can be disaggregated by race at the local level. This is challenging. Oftentimes you can get county level data. It's harder to get county level data that you can disaggregate. The second was that we wanted it to address an issue that came out in the qualitative assessment. We wanted to prioritize things that are relevant to resource allocation and policy decisions made by the board. The fourth and fifth are about having data over time that they can monitor progress. And then we were also looking for balance across the continuum of care and between adults and youth. So here is the preliminary list that we got to. So we got it down to 13 indicators. And we're in the process of kind of clarifying and finalizing what's going to be included. So the ones that are in green, we know for sure are available. Many of those are posted online. The ones in goldenrod are where we have a request pending for data, or there's some limitations that we're working through. And then the blue ones are ones where we know the data does not currently exist, so they're going to do some data collection. Closer look here. These are the indicators for which we know data is available. And I'll dig into the details on 2 of these just to illustrate how we use the indicator menu. This first one is behavioral health related deaths. And what we're looking at doing here is actually combining overdose deaths, suicide deaths, and alcohol related deaths into one combined measure. That helps us get bigger numbers for these relatively small counties so we can do some meaningful disaggregation. So that's a little more advanced analysis, but that is something that they wanted to explore. So let's take a look. I'm going to pull up the indicator menu. You all should be seeing this Excel sheet on your screen. And overdose deaths and suicide deaths are in the population level mental health and addiction outcomes tab. So I'm over in this tab. And if we go down to row 29 and row 30, that's where we have suicide deaths and unintentional overdose deaths. We see that the source is ODH vital statistics. We can then go to the links tab. So towards the end of the spreadsheet, there's a tab called links that has our links to data sources. And right here, we have ODH vital statistics via the Ohio Public Health Data Warehouse. Then we click on that. and it pulls up for us the data warehouse website. And Lorena's going to demonstrate for us in a minute how you can go in and pull data on that website. So that's one example. Another example here is children in out-of-home placements due to parental substance use disorder. So we'll go back to our spreadsheet. This one is in the mental health needs tab. I'm going to go down to row 16. So here we have children in out-of-home placements. We see that this data is available from the Ohio Department of Job and Family Services dashboard. We can see that it is available at the local level. It is available online. And so we are going to go to our links tab. So we're looking for ODJFS. ODJFS, Children's Services Dashboard. We click on that link, and that brings us to this page. Go to the interactive dashboard, and it has a list of different indicators that you can pull. We are interested in this one, removed from the home due to parental SUD. And it pulls up the county level data. So this website is helpful because it tells us what is the data that ODJFS is tracking. If you wanted to get into even more detail than what you can pull down from this website, you can always reach out to, of course, your local public children's services organization, or do a data request to ODJFS if you want greater detail on any of that. So two examples there. And then now I'm going to go to our second kind of category of indicators that we're looking at. These are ones where some of them are a little iffy. We're working through some of the limitations, or we have made data requests. So this one is a good example of indicators that require a data request. So let's look first at this one, follow up after emergency department visit or hospitalization. So we are going to go back to our spreadsheet. This one is in the quality and services outcome category down here. So we have follow up after ED visit for mental illness. There's also one for substance use. This is a HEDIS metric. So this is data that is tracked closely by the Ohio Department of Medicaid. It's one of their quality strategy metrics. So we see here, this is Medicaid data that can be available via OhioMHAS. We see over here, the data is not available online at the local level. It may be available upon request. So this is one where we have put in a request to OhioMHAS, and Craig is going to talk later on the webinar today about how you can do a data request. All right, now we're going to look at this next one, which is emergency department visits for behavioral health conditions. Back to our spreadsheet. This one is in the utilization tab because utilization of hospital services. And we are going to go down to row 13, emergency department visits. In this example, we'll focus on children, pediatric. So that's the indicator, and we see that the data source is hospitals or health systems. So this is one where we know local data is available because hospitals have this. It is not posted online. It may be available by request. So in this case, for MHRB, what we've done is put in a data request to Dayton Children's Hospital. which serves their 3 counties. So we put together a written data request, making it clear all we're asking for is aggregate data. We are not asking for individual level data, no personally identifiable information. That's very, very important to make clear when you're requesting data from a hospital or health system. And then we've had a few follow-up calls with them to clarify what the purpose of our data request and what we're specifically asking for. So that's a good example of an indicator that requires a data request. Okay. And then our last category, these are ones where we know data is not currently available that we want, but MHRB felt that these were very important things. And so they are committing to collecting data. If these indicators are selected for SMART objectives, they will collect this information directly through their providers. So that was kind of a deep dive example of what this process looks like for one board area. And now we would love to hear from all of you. So if you have any questions about anything that I just covered, or we would just like to hear what challenges you're running into as you select indicators and develop SMART objectives, we're happy to help problem solve some things with you, and maybe your peers can also help with problem solving by sharing the work that they're doing. So opening it up to the floor here. What are you guys seeing as you do this work?
So I guess a question that I would share is, as you're talking about data requests being submitted for these indicators, what are you seeing as far as turnaround times, or what should we be able to predict for turnaround times, knowing that January is going to come and go pretty quickly?
Yeah, that's definitely a challenge. I think in many cases, the data like from the hospitals and health systems, it should be information that they're running already. And so if you're on a tight turnaround, you can talk to them about, say, this is what we're trying to get at. What do you already pull? What do you already have that you could share with us? So that can speed up your turnaround time. And then I think Craig is going to talk later on the webinar in a minute to talk about data requests, and he can talk about turnaround time for OhioMHAS data. Other things you're running into?
I guess for me, just one thing that has been a little bit of a challenge that might be helpful to kind of process a little bit is like looking at one indicator or one outcome measure for what we're trying to achieve. And
Mhm.
um, that seems a little like that there could be so much more
Mhm.
different things that could play into that. So I don't know if you guys have any thoughts on that.
Yeah, absolutely. So I think you're naming two challenges, right? One is that it's hard to just pick one thing, and that's what the template is asking for, right? Is one indicator per continuum of care category. Um, and then the other challenge is that there's so many different factors affecting the outcome, right? Is that kind of
Exactly.
the two
Yes.
things? Yeah.
Yep.
So in terms of the how hard it is to pick one thing, um, I think keep in mind that what you're presenting in your CAP template and what you submit to OhioMHAS doesn't have to be the complete picture, right? You might be doing additional work and have a more comprehensive plan that you're continuing to work on over time as you build capacity to do this work. And so, maybe there's one indicator that you include in the CAP plan, but you're continuing to explore some other indicators. And maybe there's 3 or 4 indicators that you're really going to be tracking in your community. In terms of the the fact that there's so many different factors that can affect an outcome, like for example, overdose death rates, right? Obviously, there are many different factors contributing to that. It's not all on the, it's not all the responsibility of the ATOM board. But that's where talking about partnerships and talking about those social determinants of health, bringing that in as part of the picture is important to fill out that broader picture. And OhioMHAS, and I don't know if Chad wants to jump in here, but OhioMHAS certainly understands that just because you put a population level outcome in your plan, that's not saying that the board is the only entity accountable to achieve that outcome. What it's saying is that the board is recognizing this as like a bold goal for the community and will lead and partner with others in the community to work towards that shared goal. Is that fair to say, Chad?
Yes. And also as well, I mean, I think we've talked about this before at some length. This is not meant to be a static plan. This is meant to be able to move and be flexible based on real world conditions, what is happening when these strategies are implemented, what sort of access you may or may not have to data. So when you submit that first annual update in February of 2024, if your indicator isn't something that's showing the progress that you're making, there's nothing to say that you can't change the indicator and just say, listen, we think this is a much better gauge on the progress that we're making. Or these are 3 of the 4 that we are tracking that are showing the progress of what we're trying to achieve on our strategies. So we've said this in a couple of different areas and a couple of different questions, that if you have more than one indicator and you want to include all of them, just include them in a template. Submit that template to us and say we would like these indicators included in our plan. So we're not meaning to limit you to any one indicator, to any one strategy, to any one priority, but we're just asking you for one specific one for each of the areas. So if you have more that you would like to have included on your cap, just submit those on the template that we provided to you, and say, listen, we would like to have these included in our cap. And we will fix that on the back end. So if it's too much and you feel like you're being pigeonholed into one thing and you don't think that one thing is a true measure of what you're trying to do, we can make adjustments on our end.
Okay, any other questions before we move into pulling some data? Okay, but again, you can keep putting things in the chat. So now we're gonna shift gears a little bit and actually demonstrate some data compilation from some of the websites that are out there that are useful. I'm gonna quickly demonstrate the Ohio Medicaid Assessment Survey. Then Lorena from our team in HPIO is gonna demonstrate the Public Health Data Warehouse. Craig is gonna talk about data requests to OhioMHAS. And then we have Lara Belliston and Jessica Kickle from OhioMHAS that are going to talk about OHS and YRBS. All right, so I am just going to quickly show you the Ohio Medicaid Assessment Survey. This is a household survey, and the name is a little bit misleading. It is a general household survey, so it includes people who are enrolled in Medicaid and people who are not. So it is not just about Medicaid enrollees. The name is also a little confusing since, you know, there's OHMAS and OHMAS. So this one is OHMAS with no H. All right, so I am gonna go to the website. Okay. So there is a link to this website in the updated indicator menu, or you can just Google Ohio Medicaid Assessment Survey dashboard. And the sample size for this survey is a little too small for them to be reporting county level data for all counties. There are just some limitations. Sometimes that data starts to get suppressed for some of the smaller counties. But they have put together data by board area. So very, very useful to all of you. So if you start from this main page, you can go click on Map. And if you look down here under Geography, it has an option for NMH board. And it has several indicators that would be of interest that are relevant to the CAP. There's some things related to access to care. They're not specific to behavioral health, but if you're really focused on access, those could be useful. Under health behavior, we have smoking, marijuana, alcohol, binge drinking, misuse of prescription pain medication. And then we also have, we'll look at health status. There's also loneliness and unmet needs, including unmet needs for behavioral health conditions. So some very, very relevant stuff in here. Okay, so let's just take a look at one of these. So I've clicked on health status. Oh, and I'm in the adult part of the dashboard. There is some child data. The numbers are smaller, so oftentimes that data is suppressed, so it's not as useful for child data. So we're on adult, we're under health status, and then we're going to go to this one, 14 plus mentally distressed days. We have data from several years that we can choose from. We're going to look at the most recent from 2021. We can choose different subpopulations, but for now, let's just keep it general. We click Compute Estimates. And it brings up for us a map with the percent of adults with 14 plus mentally distressed days. On here, the light yellow are the board areas where the data is an unreliable estimate because the numbers are too small, but you can see there is data for most of the board areas here. You can hover on your board area and see the data and the confidence interval for your board area. There's also a table down below, and there's also an option to download. So you could export this data in Excel, you can export the map. There's a few options for how to pull down this data. All right, so now let's say we want to look at a subpopulation. Maybe we do just want to look at adults covered by Medicaid. So we reduce that, we hit compute estimates. Here you can see because the numbers are smaller, more of the counties are light yellow, but there is still some data available. So the more you kind of choose smaller and smaller subgroups, the less likely it is that you're going to have reliable data for your board area. The other way that you can adjust things is you can look at age ranges by using the slider. So if you wanted to just focus on older adults, you could do that. Or you can do income range. So if you wanted to focus on lower income, you could do that. So lots of good options to work with on this site. Has anyone on the call used this website before?
What is that?
What's that? Didn't. I guess hopefully that was someone saying they've used it. Didn't quite catch that. Okay, now I'm going to turn it over to Lorena, and she is going to demonstrate the Ohio Public Health Data Warehouse, which is a great source for overdose deaths and suicide deaths. So you take it away, Lorena. You can share your screen.
Good morning, everyone. Yes, as Amy mentioned, I'm going to provide a little bit of a tour of the Ohio Public Health Information Warehouse. Before we get started, I'll just drop the link in the chat in case people want to play along at home. All right. So you can get there in a couple ways. Here, I'm just going to show you how you would migrate there from the main dashboard. So you come over here to mortality. And then we're going to go over here to reports because we're going to create our own. And the focal point for today's demonstration is going to be looking at unintentional overdose deaths in Montgomery County for a handful of the most recent years of data available. So then we're going to come down to Deaths of Ohio Residents Report Builder. All right. So here's where we have an opportunity to impose a number of selection choices. So I like to start by doing the maximum number of filters to make sure that I get exactly what I'm after. So let's start with year. We're going to have this as time and location, year, and then here we have a number of values. Why don't we pull the 3 most recent years of data available, and do note that the double asterisk suggests that 2021 as well as 2022 death data are still very preliminary at this point. So we'll select these 3 years of data here. Next, we'll filter to the county of residence. So again, we'll go down to demographics. We'll select county. And then we'll scroll through and select Montgomery County from this drop-down menu. There it is. Click away. We're going to add a couple more filtrations that relate to the unintentional drug poisoning or unintentional suspected overdose category. So add a new row, excuse me. And then we'll go down to the injury indicators. And the first one we'll select is that we're looking for unintentional overdose deaths as opposed to intentional overdose deaths, which would then tip us into the category of suicide. So external injury intent, and then we'll select unintentional. And now we want to look at drug poisoning. So again, we'll go back to our injury indicators. Here we'll select external injury mechanism. And then we will select drug poisoning. Click away. All right. The next set of adjustments to be made is how you want to set up your row and column. So remember that we selected a handful of years. So typically for multiple years, I like to put the years in a row. But again, this is, design choice. So let's go to time and location. And we'll select year. So now we've got our rows. Don't need to do much for columns, but I do see that there is something in the default category, so I'll clear this away. And when we go down to select measures, I like to get a lot. So I like to get the death count. I also like to get the population. And then I also like to get the crude rate. So here you would select all 3 of those from the measures column. And I think we're set. So here you'll see a couple of radio buttons at the bottom. This export data is useful if you'd like to export your data as a .csv file, if you want to transport that to another platform to conduct some statistical analysis. Otherwise, you can just hit show report. It'll take it a second to compute. All right, so this is probably pretty tiny for you all, but here you'll see the Ohio residents' deaths. You'll see a list of data filters applied in this report. And we got what we asked. So here you see for the rows, you've got the years, the death count, the population, and the unadjusted death rate. If you like this format and you want to keep it, you can go up here to the top, the little save button, and you can export this format as an Excel. I do also recommend that this business here, the list of data filters, does not travel with the Excel export. So if you are iterating through this and want to, I would recommend grabbing this information because it can be very helpful for documentation. Let me pause here to see if there are any questions before we pivot to looking at some stratification by race. Okay. So the second part of the request was to, so this is for Montgomery County overall for the years 2020 through 2022. But what if we wanted to look at the rate of unintentional overdose deaths by race? So here's pretty simple because notice that none of this has really changed. So we'll add one more layer of filtration. And this time we will go to demographics. We'll select race. So bear in mind that not all race categories will be heavily represented across all jurisdictions. So bear that in mind. We're just going to go ahead and select all, and then you'll see what I'm talking about when we get the information. So select all, click away. And then we're going to do a little bit of a switch to keep everything tidy. So instead of having the year as the row, I'm going to switch it out for the race stratifications. So demographics, race, and then I'm going to do a switch and then move the year as the column variable. So time and location, year. Everything else should remain the same. Let's see what we get. Give it a second. All right, so here at the top, we see that the row variables are for the race categories in Montgomery County. And then for the years 2020, 2021, and 2022 up at the top. And you'll see that we have we've preserved the same format, death count, population, death rate. And here we see the counts and the calculated rates for mostly the white and black race categories. So you'll see that this asterisk here denotes that the data have been suppressed, which, as I mentioned previously, is not terribly surprising. But then the same second verse, same as the first. If you wanted to download it, you would just come up to the save icon, export it as an Excel, or if you wanted to keep it as a CSV format, then you come back to this radio button here for export data, and then you would get it as a CSV. And if you want to see what that looks like, and then you get it right as a CSV that you can retrieve from your downloads file. So I'll pause here for any questions, or Amy, if there's anything that you wanted me to go over or anything that you'd like to add.
No, that was great. Thanks, Lorena. I just want to point out to the group that this information, so overdose death rate, obviously there are other places that you can get this. It is included in the county profiles that OhioMHAS put together. And of course, ODH does their annual overdose death report. The challenge with those is that there's a little bit of a lag and they don't necessarily have the disaggregation within county or within board area. So this is just another tool if you have the capacity to use that will allow you to do more with this information, to do disaggregations, to look at trends, to look at things more. It's not real time, but I mean, they are putting in the 2022 data as it becomes available. There's usually at least a 6-month lag on when that data is entered. So if this is going to be the place where you're going to get the most recently available data on suicide and overdose deaths. Or you could, of course, you can also work directly with your local health department on this as well. So this is not, I realize this is somewhat complex. You don't have to use this, but it is another tool in your toolkit if you want to dig deeper into the data. Any questions on that? Okay. All right. Well, our next source that we're going to look at is data requests from OhioMHAS. And for that, I'm going to turn it over to Craig. And Craig, I can advance the slides for you.
All right. So we're going to talk a little bit about how you would go about requesting data from the department. We've come up with some new ways to do this, and we actually have a data governance policy now. So it used to be a lot more informal, but this will help us out a bit. So okay, next slide. All right, so basically, we've created this policy to make sure that we are responsive to data requests, and also to figure out, well, how do you make the data request? What are the requirements if we are asking for data? So next slide. So one of our issues is, we want to help secure data for everybody who wants it. However, OhioMHAS, our priorities are our legislatively mandated responsibilities, and those are our top priorities. So while we will work to, complete these data requests, always remember that these are additional responsibilities. And so sometimes it takes a little bit longer. Next slide, please. So these are the types of data requests. So you can have all sorts of different types of data requests. Sometimes they're for research, sometimes they're for evaluation, sometimes they're for individual client level data, sometimes they're to comply with federal laws. Sometimes we're asked to provide reports. So there's all sorts of different types of data that were requested. We are also requested for PHI, or personal health information, or PII. And in those cases, we have to follow federal laws of HIPAA and 42 CFR. And usually that requires a data use agreement if we're going down that road. Next slide. So what are the types of data that we have available? Okay, so I have a couple things here that are important. We do not have the ability to approve data agreements for data that is not, we're not directly responsible for. So if it's not from OhioMHAS and we do not own it, we can't approve a data use agreement for that. You have to actually approach the responsible state agency. So, for instance, all requests for Medicaid individual client data, you have to go through, obviously, the Ohio Department of Medicaid for that. And they have their own request procedures. And they even have a website that you can look at. So what are the data sets that we are directly responsible for that we can actually provide data? We have the Ohio Behavioral Health Information System, the OBIS system, which many of you are familiar with. We have state hospital data, or regional psychiatric hospital data that we have access through PCS. We have our licensed and certified behavioral health provider information. We have peer support certification data, community linkage data, recovery services data. Those are SUD treatment services in Ohio's prisons. We have data required for grants administration by the department. So these are things from SAMHSA or other federal entities typically that require us to collect data. Things like the SOAR, GIPRA, things like that. So we have access to that data. And we also have client level data on first episode psychosis. So we have this set aside from the block grant that requires us to collect data on anybody who receives first episode psychosis. So we have that data as well. So we do have access to Medicaid data. And, as long as it's aggregate, we can actually provide that information. So, and it meets a certain cell size threshold. So we talked to Medicaid a couple of weeks ago, and they said no data can be provided for cell sizes under 50. So keep that in mind when you do want aggregate data. That's important. So we would have to block any data that was less than 50, especially when you start to get down to smaller cell sizes, when you're starting to look at race and ethnicity, for instance, or subpopulations. Sometimes the data gets very small and we can't report that. All right, it's potentially identifiable. So what to include in your data request when you make your data request? So this is just a long list of things. Obviously, your organization name, contact name, contact address, email, so contact information. What's the specific data that you're actually requesting? What are the data elements that you want? When do you want it? And also the point in time that you want it. So let's say you have, I want OBIS data from, this date to this date. That's very important. We need that information. What's the file format that you want it in? Obviously completion date. For research proposals, all research proposals, if you send researchers to us, need to have an IRB approval, or is it in process? We also need to know if you've made previous requests for the same data and when that was. And if there is PHI or PII, has a data use agreement been completed for the request? Okay, next. All right, so the approval process. So we go through each request. We look for completeness. We look for consistency with the goals, objectives, and mission of MHAS and the department, the benefit and potential harm to the department, its clients and staff, and obviously protection of rights to privacy and informed consent of service recipients. So these are things that we need to look at before we can provide data, obviously. So all the data requests have to go through the data governance committee that meets monthly right now. And then this is where we send our data request. I know I'm 2 minutes over. So which is qpradmin@mha.ohio.gov. So that's where you would send your request. All right.
Thanks, Craig. Any questions for Craig?
There's a lot there. Well, you'll be sharing these slides, I take it?
Yeah, we'll
Okay,
send
good.
Chad a PDF of the slides.
Okay, good. So everybody can have it.
Yep.
I just have a quick question. How long does it take to get data from you?
So it depends on the type of data. And if we are in the process of, doing our other jobs, we will give you a time frame, or you can give us a time frame in terms of when you want it. But I would caution and make sure that if you're asking for data, that you leave enough time for us to actually complete the data request. So like 1 week out is probably not a good idea. A couple weeks out is even probably, not the best. Because, like right now, we are doing block grant reporting and collecting data and submitting data. And our office is primarily responsible for that, which brings in well over 100 million. I think it's almost 200 million or more dollars to the state for services. So we just need to have enough time to actually complete the request and do our additional responsibilities. All right.
Okay, now we have our final data example here. So this is the OES and the YRBS, and we have Jessica Kickle from OhioMHAS, and I'll just advance the slides for you, Jessica.
Perfect. Sounds good. Thanks for the introduction. I'm Jessica Kickle. I serve as the school and community lead for OES. So I'm just going to give you a little background about what OES is, the types of data we collect, and some of the data we have available for your use, as well as some upcoming advances for OES in the new year. So for those of you who aren't familiar with OES, that's the Ohio Healthy Youth Environment Survey. So we are a youth survey designed to measure health risk behaviors and environmental factors that are impacting youth health and safety. So we collect information that schools and communities can use to ultimately access resources so we can create healthy and safe community, school, and family environments for our kiddos. By implementing OES, we're allowing schools and districts to have their students voice the risks that they perceive to their health. Since they're the ones taking the survey, they're the one answering the questions, we get to hear directly from our students. And this allows us to start to meet the needs of middle school and high school students by asking them what's going on in their lives. Next slide, please. So just to step back for a second, we're one of several youth surveys that are out there. There are two main ones in the state of Ohio that kind of go through the state. We work very closely with the team at ODH that runs the YRBS, YTS, the Youth Risk Behavior Survey, Youth Tobacco Survey. And there are some similarities and differences in what we do. So like I mentioned, the YRBS is administered through ODH, and they aim to collect state level representative samples. So they basically do sampling that's provided through the CDC, and they get statewide results. I can't get too nitty gritty into YRBS details, but if you did have questions or wanted to know more, I have the contact information of my colleague, John Kraus, over at ODH, who oversees YRBS staff. As far as OES, we are administered through OHMAS, and we are representative only to the students that are taking the survey. So we are providing local data. All Ohio schools are eligible to use OES if they have grades 7 through 12. And we have some built-in flexibility for our schools as far as survey version, which grades are taking it, and when they take the survey. We recruit every 2 years, so we're in the middle of a recruitment administration, but we do have ourselves available yearly. So we do have data every year, I believe starting from the 2015-16 school year, and we aim to provide local results. Next slide, please. So just to cover our content areas so you know what types of questions we're asking and what sort of data is out there. I also want to note that we have both versions of our survey available on our website if you wanted to look at individual items on OES. But we aim to kind of cover a broad variety of topics to give a snapshot across the board of what is going on with students in their school. So we ask questions on demographics, substance use, mental health and suicide, adverse childhood experiences, bullying, school climate, safety and violence, school connectedness and success, physical health and well-being, gambling, community, family, and peer factors. We ask about parental attitudes. And then on our optional version of the survey, there are 10 additional questions that ask about sexual victimization and sexual health. It's up to schools as to which version of the survey they feel is appropriate to use with their students. Next slide, please. So as far as data goes, we kind of have two levels of data. And if there's a little time at the end, maybe I can share my screen and show you where some of this lives on our website for the time being.
Sure.
But as far as public data, what's going to be most readily accessible for you all are our public reports. So there are several kinds that are available. We have all OES for each year. So that's any student who took the survey that school year. We have county level reports, and those are available when 2 or more districts participate during that school year. We also have reports by Behavioral Health Board and within the Appalachian region. So those are all up on our website, except for last school year's is not up there yet, but we do have those and are able to distribute those upon request. I can follow up with Amy with a list that we do have for the last school year, 2021, 2022. So if you are looking to get access to those reports, that is a PDF that we can send out. And we also have some data up on the data warehouse. It's a couple years behind as to what's up there because we are currently transitioning over the Data Ohio portal, and we anticipate that work to be ready early spring of 2023. There's also a private data that's more so available for our schools and districts. They receive reports from their students in their school and their district, and they also have a level of access to that data, to the data warehouse for now, which will also be transitioning to the Data Ohio portal. Next slide, please. And just to give you a snapshot into what's going on and what will be coming in the future, we had a really good recruitment year this year for fall 2022 administration. So we recruited 305 schools, so that's 185 districts across 57 counties. So we would anticipate that at least 250 of those schools will actually complete implementation, and that 40 or more county level reports will come out of this. That data won't be available until spring 2023, though. And then just some advances coming. So I mentioned we work very closely with our colleagues at ODH who work on the YRBS YTS. We are actually currently developing a combined survey called Ohio Youth Surveys with them. Part of the reason why I want to point that out is our data and their data, as well as the school health profiles, will be living on that website when this website launches, hopefully early next year. There will be a hub for reports and data access for all three of those surveys. We also have our Data Ohio portal that's in development, and we anticipate that to be ready early spring. The great thing about that is it'll be a lot more user-friendly. We have Tableau data dashboards in the form of tables and charts, so that our schools and communities can look at data by gender, grade, race and ethnicity, as well as other ways. And like I mentioned, we anticipate an early spring go live on that. I don't know how I'm doing on time and if it would be helpful for me to share my screen and show where those reports live on the website.
Sure, we're a little tight on time, but I think it would be good to see that.
Do it really quick here.
Share it quickly.
I can put this link in the chat as well, but if you on an OES website and you go to public access reports, you'll end up here. So for example, if you wanted to look into county reports, it goes in here by year. So if we wanted to look in here, you would click on your county. And if my internet would catch up, you'll be able to access the report. It shows every item that's on OES in the form of tables, as well as some other calculated variables. Same way if you wanted to look at the behavioral health boards, it's the exact same click through. But for the sake of time, I will end there.
All right. Thank you, Jessica. Any questions for Jessica?
I just wanted to add, this is Laura, the Times 7 reports, because of some approvals on the Department of Mental Health and Addiction, and those were only very recently, within the last couple of weeks, approved to go up on our website. But given that the new Ohio Youth Surveys website is going to be going up shortly, those are not posted. We have about 12 or 13 counties that had Times 7 reports available for the data that was collected last year, and those were sent out directly to board directors. So if for some reason you think that your county collected data and you didn't receive that, please contact us and we can send those out directly to you.
Great, thank you. Okay, so that was a whirlwind tour of some of the sources that are available for you to use. And I'm going to turn it over to Haley and Chad to close us out.
We're going to wrap it up. Thank you guys so much for spending the time with us. If you see our next slide, we're going to post the survey for today's webinar in the chat. Chad's going to do that. He's also going to send out the survey via email. Thanks for taking this quick survey to help us provide better TA to you all. Next slide, we want to just give you a quick note about the last month of technical assistance as you wrap up your assessment and plan work. CAP office hours continue. You know, Chad is your contact for those. Our final webinar from the HPIO team will be on January 12th, not the 2nd. Won't see you on January 2nd. We'll see you on January 12th. And at that webinar, we'll have a bit of prepared material, but the majority of that time will be spent sort of in open Q&A, helping you wrap up questions that you have to get ready for the end of the month, your submission date. in case you weren't aware, want to make you aware of the technical assistance fact sheets that our team has been producing to assist you through this process. The Elevating Equity Through the CAP fact sheet is available now. We are wrapping up our work on the SMART Objectives and Standardized Indicator fact sheet. These are pulled heavily, the content is pulled heavily from these webinars. So you've seen this material before. We hope that these fact sheets serve as a useful cheat sheet for you as you're working through some of these issues and producing your plan. Those are posted on the same website that Chad shared earlier, or will be once the new one is ready. Here is Amy, my contact information. As always, you are welcome to follow up with us with any questions that arise as you're doing your work, in addition to the reach outs that you've been doing to Chad. So thank you very much. Chad, anything you want to say and wrap up?
No, so I did put the link to the SurveyMonkey in the chat. I will also send it out so later this afternoon with the updated standardized outcome indicator spreadsheet. We'll make sure the toolkit is included in there and the slides for this as well. And then all of that will be uploaded to our website here, probably, hopefully, fingers crossed, before the end of the week. So you'll have access to that when and if you need it. But I will send everything out via email later this afternoon, so you have all of it. We will update the FAQ as well. So look forward to that email later this afternoon. If you don't receive it by about 3 o'clock, give me a shout out. I'll make sure you have that information as well. But I do want to thank Haley and Amy and Lorena and Craig and Jessica and Laura for their guidance and input and information for today's webinar. And we will see you in January. If you have any questions anytime, please feel free to reach out to any of us. You have our contact information. Thank you. I hope everyone has a great rest of your day and great rest of the week.
Great
Happy
rest of the
holidays
year.
all.
Yeah. Bye.